JUUL filing in court today to extend the temporary pause on its product ban. It's hoping to counter last week's FDA order to stop selling products in the U.S. Now, since that announcement, many have taken to social media to tout what they say is the relative safety of vaping. So we're verifying tonight.
Among the online claims we're seeing, assertions that only illicit THC-based vaping has caused injuries and deaths, not vaping of regulated nicotine products, which would be targeted in part by the JUUL ban. So we're asking, are THC products the sole cause of vaping-related illnesses and deaths in the U.S.? Our sources, Alyssa Dittner, respiratory therapist and COPD program coordinator at Novant Health, and the CDC. In August 2019, the CDC started tracking an outbreak of lungs damaged after vaping. And over a 6-month period, it recorded more than 2,800 vaping-related hospitalizations and deaths. The average age of those who died was just under 50, but some were as young as 15. It also found 33% of patients only used THC products. 14% said they only used nicotine. Others used both. In late 2019, a CDC official addressed the study's conclusion that vitamin E acetate added to some THC products at the time was likely behind the outbreak, but
that does not mean that vaping products with THC or other substances are safe, and it doesn't mean that e-cigarettes that are nicotine-only are safe.
Dittner says she hears from patients who vape, even young ones with asthma attacks, fatigue, and anxiety, and others near someone else's vaping cloud have reported breathing problems.
Vaping is still relatively new, and it really just is approaching its second decade. It took several decades to link lung cancer and other lung-related illnesses to traditional cigarettes because it takes a long time for these things to develop.
So we can verify, no, THC products are not the sole cause of vaping-related illnesses and deaths in the U.S. What's more, we're still learning what vaping does to the body.